Thank you, and good afternoon. Throughout our reopening process, we have moved responsibly and in a phased and systematic approach. We have we strive to strike the very difficult balance of the dangers of coronavirus and the negative and very real impacts on our economy and our way of life. To try and find the balance that allows us to reopen, to try and find the balance that allows us to move forward, to try and find the balance that restarts our economy, protects public health, but most importantly, to try and find the balance that allows us to continue to move forward. Both the lessons of history and the lessons of some other places around the world are that moving too fast, too swift can lead to a second wave, and a second wave can re-trigger restrictions. And that would not only be devastating for our psyche, it would be devastating for economic recovery. And so we continue to try and move in the most appropriate manner, balancing all of those various factors that we see. In this same spirit of moving responsibly, of moving in phases, of moving in a thoughtful approach, today Governor Gavin Newsom announced new criteria that, if met, allow for counties to continue all the way through stage 2 reopenings at their own speed. We believe that we meet these standards, but we will wait for a formal briefing by our public health officer at tomorrow's County Board of Supervisors meeting. If we are allowed to move forward, it could be very rapidly in opening and allowing these new entities in San Diego County. And the major entities remaining in stage 2 are in-person dining and in-person retail. In addition to that step, which we believe we could make in the coming days, the governor alluded to the possibility of moving into stage 3 in early June. He specifically cited hair salons, counseling and church services and sporting activities as things that he believes, if our current trends continue, will be things coming in weeks, not months. And so this is encouraging progress. Today, when the governor provided new guidance for counties, it was around issues of stable or downward trend of hospitalizations, being that hospitalizations of COVID individuals on a 7-day average have a percentage change of less than 5%. They also alluded to cases, less than 25 new cases per 100,000 residents in the past 14 days, or less than 8% testing positive in the past 7 days. And in a large county where we're doing a lot of testing, we do rely on this percentage of positive and not the total number of positive cases that are done. He also alluded to testing capacity, which we are striving valiantly to get to our goal of 5,200 per day, which is in line with the state's goal of 1.5 per 1,000. They talked about contact tracing, which we are also moving forward with, hospital surge capacity, which we monitor and track daily in the chart that you'll see in a few minutes, efforts around skilled nursing facilities and vulnerable populations, along with personal protective equipment. So again, we believe we meet these standards, but our public health officer will provide a formal briefing to the Board of Supervisors tomorrow. But if we are cleared based on these standards, then we believe in the coming days we could see progress around in-store retail and dine-in restaurants. Now, for all of these entities, they need to be prepared to move quickly in the event we get the okay to open. You'll want to create our safe reopening plan, which is at the county's website. And you'll also want to download the state of California's recommendation and guidance for both in-person retail and dine-in restaurants. Those are available on the state of California's website. And so if you are in those entities, I would download those guidance, I would look at our plan, and I would stand by to be able to move as rapidly as possible. And again, this is just stage 2. We think could happen in the coming days. And we are encouraged by the governor saying he believes in stage 3, that could be coming in the early part of June, which I know will alleviate some anxiety in terms of what's happening. In a minute, I'm going to jump into our testing numbers, but I want to just quickly pay reference to the progress we saw over the weekend. Yesterday, we reported 4,362 tests. On Saturday, we reported 4,505 tests that were performed each of those 2 days. We report the tests reported to us, both positive and negative, not the tests that were conducted that day. And so as we've seen over the preceding weeks and months, we tend to have a little bit of a dip on Monday or Tuesday, as there's a little bit testing done on Saturday and Sunday. But I do want to recognize that continued progress that we see around our testing and around the continued stepping up that we are having moving forward. I also want to outline we have free testing available at 4 different locations through our partnership with the state. That's a capacity of about 800 tests a day. New is the Tubman Chavez Center in Southeast San Diego. That opens tomorrow. Also new is the former County Assessor's Office in El Cajon. And then continuing is the former Sears Building in Chula Vista and the county's North Inland Live Well Center in Escondido. You do not need a doctor referral, and in a minute, I will share the link, website, and phone number one more time. You can sign up for this testing. Quick update on homeless testing at the convention center to date. 1,594 tests have been administered at the convention center. That number has not changed since was reported out Friday. We have had reports come back, testing results come back, and since Friday we've had 342 additional negative tests. We have had no change in the number of positive tests. The number of pending results have come down, and the number of indeterminate tests has gone up 4. And so we will continue to update you on all of those. Now we'll jump into our T3 chart to give you a sense of where we are this weekend. We crossed the threshold of more than 100,000 tests having been performed in our county. Our daily total today is 3,408. Again, we were in the 4,000s both Saturday and Sunday. It's common Monday, Tuesday, we get a little bit of a dip, but we are continuing to advance. Contact tracers, you see 235. Again, we continue to build out this workforce, and it continues to increase very consistently with the increase that we see in testing, and those two numbers do go together. We're presently treating 159 individuals in our public health motel rooms, and that is the third T, testing, tracing, and treatment. If you would like to sign up for testing, on this next chart, you can see the information. You go to that website, lhi.care/COVID testing, and you can sign up there. You see the 4 locations that are available for testing, the 2 new ones, the Tubman Chavez Center in Southeast San Diego, the former Assessor's Office in El Cajon. We also have the existing location in Escondido and existing location in Chula Vista, and all 4 of those will remain in operations for the foreseeable future. You don't need a doctor's referral. You must have an appointment, and if you don't want to utilize the website, you can call the 800 number there you see on your screen to get scheduled. Today we're reporting 110 new positive cases. This is out of the 4,408 tests that were performed for a 3% average. Again, our rolling average is 4.1%. You see over the weekend we were averaging 3% and then 4% relative. We expect this number to continue to trend downward as we continue to increase testing. And again, if you look at this chart in totality out of the day-to-day numbers, you can see we are stepping up our testing. We had a range in the 2,000s, range in the 3,000s, then we had a number of days in the 4,000s, and we want to continue this progress as we strive to hit our initial goal of 5,200 tests per day. On the daily hospital census there, you can get a sense of where we are at 150 COVID-related ICU patients presently, and 380 total COVID patients in our area hospitals. Again, these are remaining generally flat, which you see over time, slight increase in ICUs over time, but generally remaining very, very stable. Next, you will see the COVID-related patients at 380, non-COVID on top of those, and that's where you see that healthy differential between total current hospitalization and current bed capacity. That is one of the metrics the state is looking at in terms of how much surge capacity do you have in the event that you saw an uptick in cases. And then our final chart here is just our cumulative totals, both positive, estimated recovery, hospitalizations, ICUs, and 211 are the number of COVID deaths in San Diego County. It is actually 211. It is all 211. And our deepest condolences go out to the family members of those 211 individuals who have died as a result of the COVID outbreak.